I'm Jim Check. You're watching KelownaNow, and I have with me again Terri. Terri was a fired healthcare worker up in the Vernon area, and we're glad to have you back, Terri, and for a response to the lifting of the vaccine mandate and your reaction to that.
Well, Jim, to be perfectly honest, I don't think that we were expecting Dr. Henry to rescind the mandate. She's just been holding on to it for so long. So, I mean, the initial reaction was, oh my goodness, this is wonderful news. However, there was, some other information that she brought out in the announcement, regarding the vaccine registry. And they didn't say anything about the healthcare workers having their seniority reinstated and benefits and that kind of thing. So we're excited. It's a step in the right direction. However, we're just waiting to see what the unions and the employers come up with and how the whole hiring back is going to work and that sort of thing, right? So so we're still waiting for some news on that, but it is definitely a step in the right direction.
So the question on many people's minds is will many of the workers that were fired go back to work? I understand some of them have left the province for jobs outside the province, and that would be hard to entice them back, I would take it.
I think so for sure. We have the members in our group is kind of just a subset of everyone. We have talked to them though. There's definitely, some that will just go back immediately and just, no questions asked, just head on back. There's also a lot that are waiting to see if there's going to be any form of compensation. A lot of people are really worried about their pensions because when we were fired, we were forced to deal with our pensions at that time. So, that's a part of it, right? A lot of people want to know, am I getting my job back or do I just apply for a job that's not something that I want to do? There's just so many questions there, right? I think even a lot of people who said, "Oh, I'll never go back," a lot of people felt like it was kind of an abusive relationship with the employer at the time that we were fired. I think a lot of them might be having second thoughts about that now, right? Because we are really wanting to get back to help with the healthcare crisis. And do you know what? We'll just have to wait and see, Jim. To be perfectly honest, I think that out of our membership, we had maybe 10% of people saying that they would go back if there was compensation. About 40% of people said that they were unsure. They wanted to hear what was going to be offered, that kind of thing, right? So it's a little bit early to say right now, especially because we have only just heard from one of the unions about how it's going to work, right? Getting us back.
Yeah, the leader of the official opposition has said that that everybody should have been back to work, and he also said, Kevin Falcon yesterday, that there should be some type of compensation. He didn't come out and say what type of compensation there should be. He said to get some of the people to come back to work. The leader of the BC Conservative Party, though, says that people should get compensated, and I think to a larger degree, it's his statement. And I don't think any of those words came out of Adrian Dix or Dr. Bonnie Henry yesterday. So I have a question for you, though. If you had the opportunity to ask questions of Adrian Dix or Dr. Bonnie Henry, do you have some questions for them right now that you need answered?
The biggest question that we need answered is regarding the new vaccine registry that they're creating for all of the employees to provide their immune status to everything, right? It's not just COVID related. Now, the reason that we're a little bit concerned about that is because healthcare workers have always had to self-report on their flu vaccine status, as well as when you get hired, you provide them with your immunization card. So it's a little bit concerning because they already have all of that information. So we're a little bit nervous about what this new vaccine registry requires. Like, do all the employees have to get their blood tested to provide that? are our employees going to be put on leave if there's an outbreak of diphtheria? Or it's worrisome for all employees, though. That's not just for us, right? And now the other question that we would ask them 100% is, are you going to retract Bill 36? Bill 36 is the other thing that is ruining our healthcare system. Um, it was rushed through the legislature there, and there's a lot of stuff in it that is detrimental to our healthcare system, and it's especially to doctors and others who have colleges. So we want to talk to them more about that, because it's definitely another huge issue with our healthcare system.
Adrian Dix's comments on the Friday was that he respected your decision and others, and he never tried to divide people. Do you find any, like, is that what you heard?
That's what I heard him say, and it's definitely not true. He definitely caused very, very big problems between him and Dr. Henry, and Dr. Henry saying that, people who don't get vaccinated don't deserve to work in healthcare and that sort of thing. It really created huge issues in the work sites, because there was little to no respect for the people who were, worried about the COVID vaccinations. Everybody, they divided everyone in the workplace, right? So there was a lot of bullying, harassment, that sort of thing going on, and because of that, it's going to make the return to work extremely hard for everyone, right? It's
Yeah, and you've suffered some personal loss. You sold your home, and then you took your kids out of school and all that kind of stuff. So I can remember the statement saying, like what you just said, that there's no place for these people in healthcare and all that kind of stuff. So that seems to be pretty hurtful and harmful comments. And then to say that you didn't say them seems odd, for sure, right? But again, it's the path forward that makes sense, because we can't change the past. What they've done in the past is what they've done. But like, obviously getting your job back is number one. Two, because that's going to help people in British Columbia. And then two is like some type of compensation, or even an apology maybe, or something of that nature. But I guess, is your family feeling better itself? Are you planning to go back to work?
You know what, Jim? I don't know at this point, because our lives have changed so dramatically. I'm playing the wait and see game. I want to see, if I hear from the employer, if I hear from my union. At this point, I haven't heard anything. So I do still talk to some of my old coworkers, and I think that it would be helpful to have people come back. So we'll see. I think if I were to go back to work, I would probably just work casually. I don't know if I would be able to sign a contract again with the employer after what happened, right? Because they weren't very nice about it. So I,
Understood, but if there is a change of government, obviously that would make another change, I guess, right? And I'm sure British Columbians would love to have everybody come back to work, because obviously our healthcare system could use the help, could use anybody that's able and licensed to come back to work.
yeah, absolutely, Jim. Another thing that I just wanted to bring up quickly is we have heard from healthcare workers who are still working, and they are upset about the mandates being dropped, because they felt like they were coerced into getting vaccinated and they didn't want to. So this is just another thing that I think that the public doesn't realize is, Minister Dix talks about all the healthcare workers who took it upon themselves to go and get the shots. But it was, there were thousands and thousands, if not tens of thousands, of healthcare workers who only did it to retain their jobs, right? So it was, I just want to reiterate to the public that, we didn't take the decision lightly. It was what we were seeing in the hospitals was, our double vax coworkers were getting COVID and off sick with COVID. So this was before we got fired. So we noticed that the vaccine wasn't stopping people from getting it. And we didn't know the long-term effects of a vaccine that was still in the stages of being tested, right? So I just wanted to let everybody know that there are, you know, thousands more workers who really didn't want to get them, and now they're upset because we're getting hired back, and if they knew that, they wouldn't have gone out and gotten the shot, right? So
Yeah, I can speak from personal knowledge that I know lots of people that have said to me that they wouldn't have taken it if they weren't, you know, if their employer didn't mandate it, and, you know, different things, and you know, hindsight is hindsight, right? And everybody was trying to do the best they could at the time, I think, and make the decisions like you did. You make the decision that best suits you and your family at the time, right? And then there's consequences and stuff. But I guess like for to say that right now the reporting requirements are, I imagine, a sticky thing for many of the people that are being asked to come back to work now.
what's that,
Like
Jim? Sorry.
the reporting requirements, I imagine that'll be a sticky one for many contemplating coming back to work.
Yeah, we'll see how that works. You know, I'm waiting to see. There's lots of speculation out there on social media, and I'm more of the type of person that says, let's wait and see what they actually say. It was
Mm-hmm.
a little bit odd that they announced it at the, you know, the rescinding of the mandate. So it makes me think that there's something more to it, which is a little bit worrisome, right? I mean, you
Right.
know, I totally understand the employer getting people to self-report, you know, whatever. You weren't basically the whole point of this, the self-reporting and that sort of thing is if there is an outbreak and it's awful, they will try to keep the workers who don't have immunity to, say, diphtheria. I used that as an example before. They just won't, they'll do their best to not expose those workers to it, right? It's more of a protection for the employees. So we'll wait and see what comes out of that, because you know that all of the workers that got fired for not getting the COVID shot certainly aren't going to want to, you know, give up more of their medical privacy, right? And especially probably not want to get blood tests and that sort of thing. So we'll wait and see what comes of that.
So did the union reach out to you first, or did you reach out to them, or?
No, actually, do you know what? I haven't even contacted the union, because I know that they actually, I believe that all the unions were in contact with the employer on Friday. The announcement was on Friday, and they're still talking with them now. Um, the Hospital Employees Union, which is HEU, they just posted an update. I just posted it on Twitter there if you wanted to see it. Just saying that you can apply for open positions if your job is not available. Your seniority will be reinstated. Your benefit banks will be reinstated. They're basically going to treat it as all of the employees were on unpaid leave. So it will follow the rules of the collective agreement as far as that goes. So that is good news. That's, I mean, it's really good news, you know, seeing that the government and or the employer is wanting to reinstate those benefit banks and stuff for everyone, right?
The other big question is you guys had a lawsuit out there. What's the path forward for this lawsuit?
Nothing's changing with our lawsuit. We are continuing on because we aren't, you know, suing for the mandates to be dropped. We aren't suing for jobs to be, you know, given back to people. We're trying to make sure that this can't happen again, right? It's and I mean, you saw on the announcement on Friday, Adrian Dix and Bonnie Henry both said that, hey, we'll do it again if we need to. And it's not fair to do that to the people of BC and the employees, right? So we're not stopping. We're trying to make sure that Bonnie Henry doesn't do something like this again.
You listened obviously to the announcement on Friday. Did you get a sufficient answer from them as to why BC was the outlier in all of North America?
No, there we haven't heard anything. They say that they had the best outcomes and they did the right thing. And I just personally don't agree. The mandate should have been dropped 2 years ago. The science hasn't changed. Bonnie Henry's claiming that this is, all her doing, right? And I just disagree. I think that there's a lot of things that led to them dropping the mandates, Jim. And I think that a lot of it is that, it's been out in the media thanks to you guys, right? So yeah, no, they don't answer it. It's typical politicians, right? They don't seem to really answer those questions. I mean, it's absolutely insane that they didn't drop it a long time ago. And Jim, the issue with that is had they dropped it even a year ago, there would have been so many more workers willing to go back.
Mm-hmm. Well, I know we did this story on the merit mayor, a couple of them actually, and he was really frustrated because I think, I might get the closures wrong, 19 closures in 2 years in his emergency room. And he says he only needs one doctor, and 2 doctors left because of the mandate. And he's not sure if they're going to come back now, right? Because they probably established a practice somewhere else already. So it's really frustrating and I think we talked about it. It seems like rural or the smaller communities in British Columbia are not really considered as much because it's one nurse or one doctor that keeps an emergency room open in these small communities, right? And it makes a huge difference.
Yeah, absolutely, Jim. I actually have a friend who lives up near Williams Lake, and she's an emerg nurse. And she actually commented on a post on social media. I think it might have been Facebook or something. And she said it was, interior health saying, oh, ER is closed. We don't have nurses. And she actually commented, hey, I live here. I'm available. I'm trained as an ER nurse. I still have my license. I'll come and work. Right.
Yeah. And I think we've been putting a lot of stories out on all the closures and we've been talking to the merit mayor, I think had a lot of weight in this. And I think that had a lot to do with the decision of them all of a sudden rescinding, because there's a lot of rural communities. I think one of the press releases said, oh, you can just drive 450 kilometers to Bella Coola to get, emergency service. So I think that started to resonate with some people and say, hey, that's not really fair to the people in those communities to say they can't have healthcare services and that they need to drive that far. Where the people in the Lower Mainland, obviously they have lots of choices, right? They may not have a great access to, but I mean, they have some choices, right?
Right. And Jim, I think that that's a big reason why there wasn't so much outcry from the public, right? Because the majority of our population lives in Vancouver, so they're not seeing it as much. Even if it's in the news, it's not affecting them very much. It's, it's really sad. And obviously it's the same as the government. The government, seems to cater to the majority of the population down in the Lower Mainland, right? So,
and we see that not with just healthcare, we see it with forestry, we see it with a whole bunch of things, right? Where it seems like the rural or smaller communities get forgotten because obviously most of the elections get decided in the Lower Mainland, right? So, I mean, I think it's time for people in the rural and small communities to start raising their voice.
Absolutely agree with that. Yeah.
Yeah, I won't take too much more of your time today. I'm glad to see that smile on your face, though, and hopefully we see you back in healthcare helping people, because I think British Columbians would appreciate that as well. And we look forward to checking in with you, in the next little while to see, let us know if there's some changes on your end, and we'd love to hear when you actually the first day you go back to work. It'd be great to touch base with you again.
Sounds great, Jim. Thanks a lot for having me.
All right, and thank you for watching Kelowna Now.